What is the primary mode of transmission of HIV? A. Kissing. B. Sharing utensils. C. Unprotected sexual contact. D. Sharing toilet seats. Answer: C. Unprotected sexual contact. HIV can be transmitted through blood, semen, vaginal fluid, and breast milk. How can you prevent the transmission of HIV during sexual contact? A. Use a condom. B. Take a shower before and after sex. C. Use birth control pills. D. Drink plenty of water. Answer: A. Use a condom. Using a condom correctly and consistently during sexual contact is highly effective in preventing the transmission of HIV. What is PrEP? A. A drug that can prevent HIV transmission. B. A vaccine for HIV. C. A medication to treat HIV. D. A medication to prevent opportunistic infections in HIV patients. Answer: A. A drug that can prevent HIV transmission. PrEP, pre-exposure prophylaxis, is a daily medication that can significantly reduce the risk of HIV transmission in people who are at high risk of acquiring the virus. What is the most effective prevention tool when it comes to HIV? A. Condom use. B. PrEP. C. Education. D. Abstinence. Answer: D. Abstinence. While condom use and PrEP can significantly reduce the risk of HIV transmission, abstinence is the most effective way to prevent the transmission of HIV. What is PEP? A. A medication to treat HIV. B. A vaccine for HIV. C. A medication to prevent opportunistic infections in HIV patients. D. A medication to prevent HIV transmission after a potential exposure. Answer: D. A medication to prevent HIV transmission after a potential exposure. PEP, post-exposure prophylaxis, is a medication that can reduce the risk of HIV transmission if taken within 72 hours of a potential exposure. Which of the following is not a reason to test for HIV? A. To ensure that a person with HIV receives appropriate treatment. B. To identify people who may benefit from PrEP or PEP. C. To stigmatize people living with HIV. D. To reduce the spread of HIV. Answer: C. To stigmatize people living with HIV. HIV testing should not be used as a tool for stigmatization or discrimination against people living with HIV. What is the most common opportunistic infection in people with HIV? A. Tuberculosis. B. Pneumocystis pneumonia. C. Toxoplasmosis. D. Kaposi sarcoma. Answer: B. Pneumocystis pneumonia. Pneumocystis pneumonia is a common opportunistic infection in people with HIV, especially those with a low CD4 cell count. What is the CD4 cell count? A. A measure of the number of red blood cells in the body. B. A measure of the number of white blood cells in the body. C. A measure of the number of immune cells in the body. D. A measure of the number of platelets in the body. Answer: C. A measure of the number of immune cells in the body. The CD4 cell count is a measure of the number of T helper cells in the blood, which are important immune cells that are attacked by HIV. What is an undetectable viral load? A. A level of HIV in the blood that cannot be detected by standard tests. B. A level of HIV in the blood that is very high. C. A level of HIV in the blood that is moderate. D. A level of HIV in the blood that is low but still detectable. Answer: A. A level of HIV in the blood that cannot be detected by standard tests. An undetectable viral load means that the amount of HIV in a person's blood is so low that it cannot be detected by standard tests. What is the primary way that antiretroviral therapy, ART, works? A. By killing the HIV virus. B. By boosting the immune system. C. By preventing the replication of the HIV virus. D. By neutralizing the HIV virus. Answer: C. by preventing the replication of the HIV virus. ART works by preventing the replication of the HIV virus in the body, which helps to reduce the amount of the virus in the blood and improve the person's immune system. What is a primary risk factor for HIV transmission? A. Race. B. Age. C. Sexual behavior. D. Income. Answer: C. Sexual behavior. Unprotected sexual behavior is a primary risk factor for HIV transmission, regardless of a person's race, age, or income. What is the window period for HIV testing? A. 24 to 48 hours. B. 1 to 2 weeks. C. 2 to 4 weeks. D. 3 to 6 months. Answer: D. 3 to 6 months. The window period for HIV testing is the time between when a person may have been exposed to HIV and when the virus can be detected by standard tests. This period can vary, but it is generally 3 to 6 months. What is seroconversion? A. The process by which a person's immune system produces antibodies against HIV. B. The process by which a person's immune system is destroyed by HIV. C. The process by which a person becomes infected with HIV. D. The process by which HIV mutates and becomes drug-resistant. Answer: A. The process by which a person's immune system produces antibodies against HIV. Seroconversion is the process by which a person's immune system produces antibodies against HIV, which can be detected by standard tests. What is a common side effect of ART? A. Nausea. B. Headache. C. Muscle pain. D. All of the above. Answer: D. All of the above. ART can cause a variety of side effects, including nausea, headache, and muscle pain. However, not everyone experiences these side effects, and they can often be managed with medication or lifestyle changes. What is the difference between HIV and AIDS? A. HIV is the virus that causes AIDS. B. AIDS is the virus that causes HIV. C. HIV and AIDS are the same thing. D. HIV is more serious than AIDS. Answer: A. HIV is the virus that causes AIDS. HIV is the virus that attacks the immune system and can cause AIDS, which is a set of symptoms and conditions that can occur when a person's immune system is severely damaged by HIV. What is stigma? A. A contagious disease. B. Discrimination and negative attitudes towards a particular group of people. C. A treatment for HIV. D. An early symptom of HIV. Answer: B. Discrimination and negative attitudes towards a particular group of people. Stigma is the discrimination and negative attitudes that can be directed towards people living with HIV or AIDS, as well as other marginalized groups. What is empowerment? A. The process of gaining power and control over one's life and circumstances. B. A medication to treat HIV. C. A vaccine for HIV. D. A medication to prevent opportunistic infections in HIV patients. Answer: A. The process of gaining power and control over one's life and circumstances. Empowerment is an important tool for HIV prevention and control, as it can help individuals and communities to take control over their own health and well-being. What is the most important way to reduce the spread of HIV in communities? A. Education. B. Condom use. C. PrEP. D. Empowerment. Answer: A. Education. Education is critical for HIV prevention and control, as it helps individuals and communities to understand the risks and ways to prevent HIV transmission. What is a vertical transmission of HIV? A. Transmission of HIV from person to person through sexual contact. B. Transmission of HIV through blood transfusions. C. Transmission of HIV from a mother.